Uterine Cancer, Symptoms, Causes, and Treatment Options, brought to you by Alexin Health. Promote our work by subscribing to our channel for more videos and knowledge about your well-being and the well-being of your family and loved ones. Across the globe, uterine cancer, sometimes called womb cancer or endometrial cancer, is a condition where abnormal cells begin growing uncontrollably in the uterus. While it sounds serious, and it is, understanding the different types, symptoms, and treatments can help empower patients and families alike. Types of uterine cancer. There are two main types of uterine cancer: endometrial cancer, by far the most common type. This starts in the lining of the uterus, the endometrium. The most frequent subtype is called endometrioid adenocarcinoma, which begins in the glandular cells. Uterine sarcoma, a much rarer form. This cancer begins in the muscle tissue of the uterus, the myometrium. Common symptoms to watch for. Don't ignore the signs, especially if you're experiencing vaginal bleeding, particularly after menopause or between periods, pelvic pain, or pressure changes in your menstrual cycle. These symptoms don't always mean cancer, but they're definitely worth a conversation with your doctor. What increases your risk? Several factors can raise your chances of developing uterine cancer, including high estrogen levels, often due to obesity or hormone replacement therapy, family history, especially if close relatives have had uterine or related cancers, underlying conditions like polycystic ovary syndrome, PCOS, or type 2 diabetes. How it's diagnosed. Getting to the bottom of the issue involves pelvic exams, an imaging button, an ultrasound, or MRI can help visualize abnormalities in the uterus. Biopsy. A small tissue sample is taken from the uterine lining to check for cancer cells. Treatment options. Fortunately, uterine cancer is often treatable, especially when caught early. Common approaches include surgery. Most patients undergo a hysterectomy, removal of the uterus, and possibly a salpingo-oophorectomy, removal of the fallopian tubes and ovaries. Hormone therapy, especially useful when the cancer is sensitive to hormones like estrogen. Radiation therapy helps destroy cancer cells in and around the uterus. Chemotherapy targets rapidly dividing cells, including cancerous ones. Immunotherapy, a newer and promising approach that helps the body's immune system fight cancer. Bottom line, if you or someone you love is experiencing unusual symptoms or has risk factors for uterine cancer, don't wait. Early detection can make all the difference. At Alexin Health, we're here to guide you every step of the way. Contact our healthcare provider on +254 7011 68 779. Call or WhatsApp